And thanks so much for staying with us here on the 4 o'clock show. On today's Health Corner, we're discussing polycystic ovary syndrome. It's an issue with hormones, and it happens during reproductive years. And joining us now to speak on this topic in depth, Memorial Health System OBGYN, Dr. Jonathan Jones. Dr. Jones, appreciate you being on the 4 o'clock show, and thanks so much for being with us. How common is this, first of all?
Yeah, thank you so much for having me. It is extremely common. So, like you said, it's a disease that happens in women of reproductive years, and the symptoms are pretty vague, but once we start looking into people's different problems, we see it very commonly.
And it happens during menstrual cycles? Primarily?
So basically, what polycystic ovarian syndrome is, it's a disease that has about 3 main parts, okay? First, it occurs with women that have irregular menstrual cycles, so that's what we're talking about, right? So people that have too few or far between cycles, or even people that miss menstrual cycles. The second component is they have abnormal amounts of testosterone or male hormones in their body. So they have things like abnormal hair growth or acne, okay?
Wow.
And then the name polycystic ovarian syndrome. So it refers to a finding that we see on ultrasound or during surgery, where we see that their ovaries don't have just like one or maybe 1 or 2 dominant follicles or cysts. And those are the cysts that lead to...
So what's the impact or the effect on a woman's life if they have this?
Yeah, so basically the main things that people complain about if they're not bothered by their abnormal periods or their acne or hair growth are things like infertility, because certainly if they're not having the normal hormonal cycles, then they're not going to be able to get pregnant, okay? The other main things are long-term effects of polycystic ovarian syndrome, like heart disease, diabetes, and even rarely things like endometrial cancer.
And when is a diagnosis made? Is it at a particular age for women, generally speaking?
Yeah, good question. So it can be any time in their reproductive years. So once they start having cycles, all the way until they're in menopause.
So even in their teenage years, then they can already start showing signs of happiness.
Yes, absolutely.
So what do you do to treat it? I mean, is there medication that can try to balance the hormone or something?
Yeah, there certainly are. So there's hormonal medications like what you're referring to. Typically the first line is simply things like weight loss. It can be extremely effective in helping out with PCOS.
So obesity is a kind of comorbidity of this?
It can be, yeah. And it can make it harder to lose weight, so it is a difficult diagnosis in that regard.
And is the medication pretty easy in terms of side effects and everything, or is it
there's a lot of
hesitate to prescribe?
No, there are a lot of different medications. So it depends on which one we choose, depending on what a woman's particular symptoms and what her goals are, will affect what medicine we choose and those side effects.
And the complications if they choose not to do anything about it.
Yes.
Just what you mentioned already?
Yes.
Or can it get worse?
So certainly things like I said, heart disease and diabetes, obesity, and one of the feared complications that we think about in our field specifically is uterine or endometrial cancer.
Well, that's very serious, actually.
Yeah.
Well, Dr. Jonathan Jones, thanks so much for being with us today. I have to confess I didn't know about this, and I think all women should do some research, especially if they're showing these symptoms. Thanks again for being here.
Thank you for having me.
And stay with us.